Thank you, Lindsay. Well, welcome to our presentation on digestive health. We're really excited to present this topic to you guys. We know it can be really applicable to all of us. So we're gonna just go over how our gut plays a role in our overall health and nutrition. First, I just want to introduce myself. My name is Megan Watson.
My name's Claire. Oh, sorry.
Hey, go ahead.
So I'm Claire, and then that was
I'm
Laurel.
Yes. Nice to meet you guys.
All right, so getting started, we want to do a quick poll and see what you guys know about digestive health. So you can access this by going to slido.com on your phone browser or computer browser, or use this QR code to access it. And from there, you'll enter your code. And so I'll give us all a minute to get that pulled up. All right, so if everyone's ready, we're going to move on to our first question here. And so we're asking you, what supports digestive health? So our first option is vegetables, fruits, and whole grains. The second option is the gut microbiome. The third option is water and exercise. The next one is none of the above. The gut does everything by itself. And the final option is all of the above. So on your browser, you'll select your option and click send.
Just FYI, if you are on your computer browser, you have to click on polls, not Q&A. I got a little confused as well.
All right, and I'm going to start pulling up the results here.
Awesome. Love to see that.
All right. So thank you for answering that. And for right now, we're done with Slido, but it'll come back later. And so we want to know, what are foods that you like to enjoy eating that will help support digestion? And you can interact by just typing into the Zoom chat box any foods or activities that you like to do. It doesn't have to be just foods. All right, so we have salads, yogurt with probiotics, going for a walk, some berries and fruits. These are all great options and ideas. Yep. Yogurt and avocado, dates and legumes. I'm loving everything that I'm seeing.
Yeah.
Lots of fiber and all these. I love it.
All right. Thank you for sharing your ideas with us.
All right. Yeah, we really appreciate y'all's participation. Y'all had some great answers. Quick outline of our presentation today. We're going to do a very quick overview of digestion in the GI tract, a little bit of gut microbiome basics, go over food and supplements and how they support gut health, common digestion and GI problems, and then finally, overall supporting how we can support intestinal health.
And so I'm going to go over some learning objectives. And so these are going to be some things that hopefully by the end of the presentation, listeners will understand the process of digestion, how food is absorbed by the body, and then listeners will be able to define the microbiome and how it contributes to our digestive health. Listeners will also be able to recognize how foods can affect digestive health. And then along with that, when presented with options of different foods, listeners will select the optimal choice to support the digestive health. And then lastly, listeners will be aware of specific GI complications and how dietary and lifestyle changes can relieve these symptoms.
So quick overview of digestion. crash course, if you will. This is the GI tract, so I'm sure we've probably seen this before, but I'll just quickly go through this. So obviously we start in the mouth, goes through the esophagus, stomach, small intestine, cecum, colon, rectum, and finally the anus. And then accessory organs would be the liver, gallbladder, and pancreas. And these will have really important functions, normally with enzymes to help the digestive process. So breakdown of carbohydrates, this is going to be really applicable to when we're talking about gut health. So digestion starts in the mouth by an enzyme called salivary amylase. Further breakdown of that food occurs in the stomach, but the majority of our digestion and our absorption is actually going to occur in the small intestine. So not necessarily the stomach, the small intestine is where most of that absorption happens. The carbohydrates that are not metabolized in the small intestine will enter the large intestine, and those will become the substrate for microflora. And that's going to contribute to that bloating and flatulence. So our microbiome, when I first was doing research on this, I honestly couldn't even tell you what the microbiome was. This was kind of new territory for me as well. So a microbiome is basically bacteria, viruses, and fungi that are in the body collectively. Those are known as the microbiome. So some bacteria, yes, are associated with disease, but others are actually extremely important for our health, specifically our immune system, our heart health, weight, and just overall health. So the majority of those microbes that do infect intestinal health are found in the cecum, which is referred to as the gut microbiome. So the higher the microbiome diversity, that is the better the health. So you want a high diversity. So how does the diverse microbiome contribute to health? Caveat to this slide, a lot of these things are still being researched. So this is not an exhausted list, and this also isn't 100%. A lot of great research is being done right now on these specific topics, but there's not a specific causal relationship necessarily. So fiber digestion, 100%, immunity, brain health, heart health, weight control, intestinal health. Definitely the microbiome contributes to all of these things. The exact mechanisms are still being studied. So dysbiosis, this would be an imbalance of that healthy and unhealthy microbiome. So this leads to less diversity and functionality. And so this is what might contribute to leaky gut, which you might have heard of leaky gut syndrome. That basically is increased intestinal permeability, which means that there's a greater likelihood that some of those inappropriate molecules, things you don't want absorbed, are going to leak through that intestinal wall. Irritable bowel diseases, bloating, cramps, abdominal pain, inflammation, and then links to some cardiometabolic diseases. So some people might consider the microbiome, or some researchers would consider the microbiome the virtual organ. And why I wanted to include this is because the gut microbiome is very individualized. Everyone's gonna look a little different, and it's influenced by your geographic location, your diet, your age, what drugs you're using in terms of antibiotics, illness, injury, hormonal changes. So in your lifespan, it'll be different. And where you live, what types of food you eat, it's going to be different. So that's why everyone has a very individual needs. So that's where that opportunity for more individualized nutrition comes in.
All right, so now that we've gone over what makes up digestion in our bodies, we're going to talk about how foods that we eat can help support that process. So starting with fiber, there are actually two different types of fiber. There's soluble and insoluble fibers. So soluble fibers are dissolved into a gel in the gut, and this will help delay gastric emptying, which means that they'll help you feel fuller longer. These will be fermented in the colon by bacteria, and soluble fibers can also lower bad bad cholesterol by binding to it and then promoting excretion. And then next, our insoluble fibers are not fermented in the colon. And these will help increase fecal weight by packing together, and it'll decrease transit time, which means less time that the feces is spending time in the colon. And this helps bulks your stool. So some examples of these different types of fibers: soluble fibers are found primarily in our fruits, like apples and oranges, and berries are also a great source. It's also found in oats and beans. And then our insoluble fibers are found in whole grains, vegetables like carrots and cucumbers, and then also seeds. So how to choose fiber-rich foods. Most high fiber foods will actually contain a mix of both the soluble and soluble fibers. So when choosing these foods, make sure you choose whole foods first and foods that you know you're going to eat and actually enjoy. And if you're looking at already processed foods, make sure to be a critical consumer. If you see that heart healthy label, go ahead and flip it around to the back to the nutrition facts and make sure you're looking for low fat, low added sugar, and low cholesterol. And over on the right of the slide here, those are some common names that might be in an ingredient list that denote soluble fiber. So we have pectin, guar gum, xanthan gum, and beta glucan. So next, we're going to talk about prebiotics versus probiotics. A prebiotic is a substrate like a food that is selectively utilized by host microorganisms, so the bacteria, and these will result in a health benefit. Whereas a probiotic are actually the bacteria, the microorganisms that can result in a health benefit. So food sources of each: prebiotics are found in our fiber foods again, so whole grains, vegetables, and fruits. And probiotics are found in fermented foods. So this includes yogurt, kefir, kimchi, which is a Korean fermented dish of cabbage, and also soft cheeses like feta, brie, and ricotta. And so if you do choose to supplement, make sure you aim for those whole food first and make sure you drink plenty of water. And when looking at probiotic supplements, the FDA doesn't currently regulate production. So make sure you consult your healthcare provider first if you are thinking about it. And when you are looking at products, make sure you look for the USP symbol on the package. This is a program that companies will pay for to accurately test their products and make sure you're receiving a good product. And so finally, the importance of water. Water plays a large role in our digestion. It can help with nutrient absorption, transportation, and even excretion. So make sure you stay hydrated throughout the day. Have a glass of water with each meal or snack. And you can also incorporate foods that have high amounts of water. So on the right, lots of the foods in this list are also great sources of fiber. So lettuce, celery, cucumber, raw cabbage, boiled broccoli compared to raw, spinach, and also raw carrots.
So real quickly, before we move into intestinal health, I saw a few questions in the chat. I also wanted to relate kind of that we just went over with actually what you guys said on our first question. So if we go through some of your answers of how you support your intestinal health, a lot of those have some similar connections to what Claire just talked about in terms of fiber, fruits and veggies, yogurt, which is a great probiotic, and all those things. So now you can kind of see the connection of what we're seeing. This really does help support your intestinal health, and maybe you're naturally choosing those foods that are higher in fiber. Also, feel free to keep the questions rolling on the chat, and we'll talk about them as we go. Thoughts on kombucha? What are our thoughts on kombucha?
I mean, kombucha can be high in, it's just live culture, so those probiotics, but something that's important to think about when looking at kombucha is that it can be high in a lot of added sugars. That's, kind of something opposite of gut health, I guess, but kind of thinking about, I guess, like, okay, is it worth kind of the added sugars? Because sometimes a lot of things will have probiotics, but they might not get all the way to our gut. They might not pass through our digestive tract enough to actually have an impact on our gut health. So That's
I
something.
think kombucha can be a great addition to a diet. I think that we really try to stress that whole food first mentality of, but definitely not something that we would say you should stay away from or anything like that. Another question, impact of whether breast milk or formula at birth, any studies of gut health for those two type of individuals? Are we referring to the mom or the baby? I guess that's my question there. But I'm not really sure. I can't speak to that question. I think I would need to go look more into that topic of.
I believe there is research that addresses formula versus breastfed, but that's a little out of the scope of this presentation.
Yeah. We don't want to tell you the wrong thing. Do I need probiotic supplements if I eat a balanced diet with whole grains, vegetables, fruits, dairy? No. That is my from a dietetic standpoint. That's really where we want most of our prebiotic and probiotics to come from is that whole food.
And eating those prebiotics will definitely support the bacteria that you already have in your gut microbiome.
Yeah. Our probiotics, we'll take this last question and then we'll move on with the next topic, but are probiotics often expensive? Ooh, Claire, that's a good question.
I feel like there is a range, but I cannot quote any specific range of prices. It would require some looking into, but currently I'm not entirely sure. I believe that they are a little bit more expensive than a typical supplement like a vitamin A or vitamin D supplement.
Yeah, and that's the trick with supplements is really reading that ingredient label and really seeing what is in that. And you would want to pay for the higher quality probiotic, I would think, just like you'd want to pay for a higher quality protein or any other type of dietary supplement.
And additionally, with our current research that we do have, we can't really specify how any strains can impact health. So that's sort of where the research is lacking. If you do identify a probiotic that lists specific strains, that would be something to bring up with your healthcare provider.
Yeah, absolutely.
And then it also might depend on brand too. It's kind of touching back to what we said, just doing your research prior to buying supplements and things like that. That will give you a good idea before going into the store and buying things.
Yeah, really great questions. Keep them rolling. We'll get to all of them. We want to make sure we get through everything. So we're going to, I think, continue on with our next topic, Laurel.
All right. So I'm going to be talking about supporting intestinal health, and I'm kind of going to be going over some of those common GI issues that probably a lot of us have experienced before. So first off, I'm going to talk about lactose intolerance. This is a super common thing amongst all people, not all people, but a lot of people. So kind of what is it? It's the inability to fully digest lactose, which leads to an excess of gas in the colon. And so like symptoms, I'm sure we're aware of like bloating, flatulence, cramps, diarrhea, abdominal distension, and vomiting. And so kind of how does this occur? So we have lactase, and in our digestive system, that is an enzyme that's responsible for breaking down lactose. So we get lactose from milk. It's a carbohydrate. And so people can be deficient in this lactase enzyme, which is causing undigested lactose to enter the colon. And Megan kind of touched on this earlier. When these unmetabolized carbs enter our colon, they cause bloating and flatulence and like these symptoms mentioned above. And they produce other things like short chain fatty acids, lactate, methane gas, carbon dioxide, oxygen, and hydrogen. And then also this lactose intolerance, you can either just have it or be born with it, or it can develop from can be secondary, so it can develop from other things. For example, infection of the small intestine, inflammatory disorders, HIV, or malnutrition. And like I said, it is very common, and there's actually some treatment options as well. So there are going to be some lactase supplements that people can take. And these can either be in the form of an enzyme tablet. And then also there are milks that are made with lactase in them. I don't know if you guys have seen before Lactaid at the grocery store, but they have like lactose free milks and lactose intolerant type milks that are going to be a great option for people. And then also just avoiding dairy. So things like milk, cream, ice cream, and cheese are going to be super high in lactose and cause those symptoms we mentioned on the last slide. And then also, there's also so many products today that are going to be lactose-free milks, kind of like the nut milks and the oat milks, things like that, that are still probably going to get that calcium intake as well that you need. And then probiotics, we kind of just touched on this, but they can help promote balance for your gut microbiome, but there's still lacking evidence that it's going to fully treat these symptoms. Okay, kind of moving on to constipation and diarrhea. I'm sure everybody knows what these are or has maybe experienced them before, but I'm just going to kind of go through some of the causes and some treatments for both of them. So for constipation, they can be due to a multitude of things, including not getting enough fiber, not getting enough water if you're dehydrated, if you kind of have a sedentary lifestyle, so if you're not super physically active, and then certain medications can also contribute to this. And so kind of bouncing off of this, ways that we can treat it, just keeping a balanced diet, so high in fiber like fruits, vegetables, a lot of the things that Claire touched on, and then also just staying hydrated. I noticed something nowadays that I like to do is just bring a reusable water bottle with me everywhere I go. I feel it kind of keeps me on track with just staying hydrated. So I just think that's a good tip. But then also staying active, and then also stool softeners and laxatives are also a great thing depending on the severity of your constipation. So now we're going to talk about diarrhea, kind of on the opposite spectrum. But so this can actually occur if we have too much fiber, and particularly looking at insoluble fiber. And then also people can have food sensitivities that might trigger symptoms like dairy, mentioned before, lactose intolerance, and then also things like sugar alcohols that are going to be in like candy and gums and things like that. And then also medications. There are some medications that if you're on for extended periods of time, they can actually cause diarrhea. And down here in the treatment, we kind of, so with going with that, with medications as well, or antibiotics, there is some research out there about like starting a probiotic when you start an antibiotic. I don't know, it's not super developed, but there's just some connection with, okay, if we start these at the same time, would that help reduce some of these symptoms of diarrhea? And then also just kind of replacing, so kind of the first things first with diarrhea, you want to make sure that you're going to be replacing your fluids and your electrolytes, because you're losing a lot of water and nutrients when you're getting that diarrhea. And then also just maybe introducing some more soluble fibers that can kind of help thicken the stool. And then once again, probiotics, yes, there is not a large amount of evidence, but it might help still promote that healthy gut and kind of help decrease some of these symptoms. Okay, so moving on to exercise. So our understanding of how exercise affects the microbiome is still a little bit incomplete, but some studies are showing that exercise can have beneficial effects on our intestinal health. So for example, exercise can improve symptoms of heartburn, gas, stomach cramps, and constipation. And then also we can stimulate our intestinal muscles through exercise, which can help push some of that waste throughout our body. And then also it can increase blood flow, especially to the GI tract. And theoretically, that's going to stimulate our digestion. And like I said before, lack of physical activity and exercise can lead to constipation. So kind of just being aware of that as well. All right. Is there a picture on this slide? I don't know if there needs.
There should be. I wonder
Okay,
why
I
it's
don't know
not.
if it's on the next. No worries.
Oh, there
There we
it
go.
is.
Yeah. Okay, so specifically, we're going to be talking about we thought this was kind of a fun little tidbit, but yoga. It can help in aiding digestive health, but it's also just going to be one of those things that's going to be a great stress reliever. And specifically, it's really good at increasing circulation throughout your body, which will also help promote motility of the GI tract. And if yoga's not your thing, like that's totally fine. Everybody has their different ways of exercise, and that's awesome. And we just thought this was kind of a fun little thing to incorporate. And if it is, awesome. And then also kind of tip out the bottom, but yoga can support symptom management, but it shouldn't replace our medications and our treatments prescribed by our healthcare providers.
So all in all, we covered where digestion begins and how it occurs. So it starts in our mouth, and then most of digestion will occur in the small intestine, and that's where we will absorb nutrients so our body can use them. We also have bacteria that live within us and on us, and the gut microbiome consists of that bacteria, fungi, and also viruses. And our body keeps a balance of the healthy and the unhealthy that will promote our health. And the more diverse this microbiome, the better our health outcomes. So digestion, brain and heart health, weight control, immunity, and intestinal health are all impacted by our gut microbiome. It has a role in lots of processes. And then dysbiosis can lead to unwanted health outcomes.
Kind of just to bounce off Claire with the summary, increased soluble and insoluble fiber consumption, many health benefits attributed with that, prebiotics from fiber foods and probiotics from fermented foods. And once again, just think about when we are going to be supplementing with these things, taking our caution prior to purchasing. And then also the gut microbiome is affected by a multitude of factors like diet, age, illness. It's very individualized, kind of like what Megan was talking about earlier in the presentation. And then staying hydrated is going to be a great way to promote our intestinal health. And then lactose intolerance, as well as diarrhea and constipation, are going to be things that many people experience and might have some unpleasant GI conditions. So let's think about ways to help reduce this. And then also lifestyle factors such as diet, exercise, and stress are all going to be things that are going to impact our digestion.
Sorry, before we move forward, I wanted to go ahead and go through some of your questions. Let me see. Ooh, this might be a question that Jennifer can help us. Curious as to tube feedings we use in the hospital. How do those impact gut health? Terrible bowel movements while patients are on those. Yes, a lot of times that definitely has to do with the low fiber content. So I think the number one thing is to, depending on the state of the patient, is maybe thinking about increasing the fiber content of, obviously that's difficult when it's a tube feeding situation.
Yeah, it's really just going to depend on what is going on with the patient. So if someone's like in the ICU, for example, and they're on a ventilator and they're tube fed, then really we're going to try and give them what's going to be the easiest on their digestive system. Other people who have tube feeding, say, for example, in children with like cerebral palsy and that kind of thing, then we can definitely increase fiber to make the bowel movements more easy. It's also a liquid, so that's another reason why that can impact bowel movements, but it also depends on the type of medications that a patient is on. But as far as the microbiome goes, that will likely shift in response to whatever is going on with the patient, but that's going to be really kind of out of the scope for this type of presentation. But good job, Megan.
Yeah, really good questions. Let's see. Y'all have great questions. Some we will not be able to answer today, but hopefully this has helped. I'm not sure about the D-mannose question. I do know, oh, it's a supplement that helps with UTIs. I'm not sure. I can't really speak to that question. I do know that medications and supplements do have an impact on the microbiome, and a lot of this is very individualized. Some people have good or bad responses to different types of supplements or medications. Tips for vegetarians. I mean, vegetarians are getting a lot of fiber. You know, that we didn't talk about this, but I do know that sometimes too much fiber can give the opposite effects. So definitely something to keep in mind, kind of, if you're going to try to incorporate fiber into your diet, especially, or if you're going to transition to become a vegetarian, definitely we would say increasing 5 grams of fiber per day to start, not, increasing too significantly, because then you could have some GI issues. We spoke about kombucha a little bit. Definitely think it's an option. Some people are sensitive to kombucha. We would definitely say whole foods first, but definitely a great, we wouldn't say to avoid it by any means. So yeah, great questions. If you have any more, you can throw them out there. Just kind of wrapping up for a big picture, lifestyle factors, diet is one, but also that physical activity, stress management, all of these can have a huge impact on your GI health. So those small changes can make a really big impact. Definitely the takeaways here, focusing on that fiber in fruits and vegetables, staying hydrated, participating in physical activity. That doesn't necessarily mean you have to be going to the gym every day. Just moving your body, walking around, that promotes that motility of the GI tract. And then reducing stress and prioritizing mental health. Like, that's a big thing that we're starting to see, that shift. It's a lot more than just the food that we're eating. It's kind of the overall big picture of our stress, our mentality, that can all affect our GI health, and it's very individualized.
All right, and so finally, we're going to have a little post quiz where we're going to answer some questions. So we're going to access the same Slido code and browser. So I'll give us all a brief moment to pull that up again. All right, so I'm going to move on here. So our first quiz, let's see. All right, so hopefully you should see it on your browser. So we're asking, where does the majority of carbohydrate digestion take place? The mouth, the stomach, the small intestine, or the large intestine? All right. So good results. All right, moving on to our next question. A more diverse gut microbiome contributes to better health outcomes. True or false?
You could also type it in the chat if you didn't want to, but we appreciate all of your responses. It's super helpful. Yes, absolutely. More diverse gut microbiome definitely leads to those better, more optimal health for sure.
All right, and our next question is, which of the following is a prebiotic that supports digestion? So high fiber foods like whole grains and veggies, dairy products like yogurt, sugar, or meat? So emphasis on the prebiotic. All right, lots of great answers again.
Yep, so yogurt would be that probiotic. And I think I misspoke earlier in the presentation about yogurt, but prebiotic would be those high fiber foods.
All right, and our last quiz question, how can exercise support digestive health? It increases blood flow to the GI tract, it stimulates digestion, it can improve symptoms like constipation and gas, all of the above, or none of the above. Good results again.
Good answers.
All right, and finally, we just have a couple more questions here at the end. Oh, it looks like we had, it took places, I guess, of who was responding to me. All right.
Yeah.
All right, so last couple questions. Over on a scale of 1 to 5, how much did you learn from the session? 1 being that you learned nothing new, and 5 being that you learn new information that you're going to share with others.
Yeah, I've never used this before, Virginia. So this is really fun. That was all Claire. You can thank Claire for this.
All right, and finally, our last question. On a scale of 1 to 5, how likely would you be to implement this information into your daily habits? So 1 being not likely at all, and 5 being extremely likely. All right, well, thank you again for sharing your thoughts with us and interacting with this Slido polling. It is a lot of fun to see everyone's answers pop up on the screen. And so that concludes our presentation. And so we have references here, and then I can also share a list of these references as well with Lindsay if anyone is interested in doing some further reading.
Yeah, thank you guys so much for your participation today. It was really, y'all were a great group.
Lots of
definitely get the slides to you, and we have a handout as well. Just a little overview of some of the things we covered today.
Yes, thank you ladies so much. Great information. I think a lot of great takeaways for us to go ahead and put into use into our overall healthy lifestyle. So really appreciate that, and some things to consider. And of course, if simple things that we can start doing today, but then if you want to dive a little deeper with a registered dietitian, I'll make sure in the follow-up email to include some of those resources that, if you are interested, could reach out to a registered dietitian if that's something that you have interest in. And of course, yep, in the follow-up email, I'll include these slides, the link to the recording of this presentation, then also the handout that the ladies have to supplement this as well. So thank you all so much, and great information.